Buenas tardes, hola a todos. Mi nombre es Ricardo Sánchez Castillo, yo soy médico dermatólogo y tengo el honor y el placer de hoy día estar compartiendo y poder conversar con el gran maestro profesor Firas Al-Niaimi y que va a compartir con nosotros su experiencia, su expertise, su conocimiento y espero que les sea muy útil. Professor Firas, it's a pleasure to have you here in Chile. I hope you have enjoyed your staying here. And I would like to start asking you some questions, nothing difficult. Please, can you help us with your knowledge? So, what do you think are the newest technologies and treatments or ideas that are being developed today in order to treat skin diseases?
So thank you very much for having me here in Santiago, Chile. This is actually my first visit to this beautiful city and beautiful country. So my name is Firas Al-Niaimi. I'm a laser dermatologist based in London, the United Kingdom. And I have traveled into many countries and given lectures. And what I'm finding is the shift in how we dermatologists are viewing laser technologies in the treatment of some of the medical dermatological conditions that we used to traditionally treat medically with creams or with tablets. So for me, the biggest shift is the group of dermatologists who are now willing to incorporate laser energy-based devices into the management of medical conditions. Of course, there is also the aesthetic side and the cosmetic side, which is growing. So therefore, what I'm finding is that the technology is becoming more sophisticated in terms of the devices themselves being operating faster with a higher safety margin. Things like the cooling is much more nuanced and perfected. The pulse duration, we're having machines with shorter pulse durations, with longer pulse durations, with pulse durations that are chops, larger spot sizes, smaller spot sizes. So the technology, it's adapting to the demands of the work, the practice, which is higher safety, higher efficacy, lower downtime. If we look at the last 10 years and look at some of the major advances in energy-based devices in the management of many dermatological conditions, I can think of a number, but one of them is the fractional technology. So the fractional technology where we fractionate the beam of light and therefore we can control how deep we can go and how much of that tissue we can actually injure in a very controlled way has dramatically changed the way we treat things like scars, for example, even rejuvenation if we talk about the aesthetic sides. And then within the fractional technology, advances in the ablative and the non-ablative fractional, then we have the microneedling radiofrequency where we can again dictate how deep we can go, preserving the surface of the skin, advances in vascular lasers with multiple wavelengths and multiple cooling methods. And then we have obviously also the picosecond lasers. So the picosecond lasers that operates with a very short pulse duration, which allows us to effectively treat tattoos, pigmentation. But even having talked just now about the fractional technology, even within the picosecond, we have fractional handpieces that allow us to give a specific type of injury to the skin. That will be, for example, very useful for the higher skin types and for some of the mild cases. So to me, that shift, the introduction of the fractional technology, the picosecond lasers, the sophistication of the existing technologies in terms of operating faster, better cooling, higher energy and more power is what I see as a major shift compared to 15, 20 years ago in the laser world.
Okay, that's very interesting. I think that I agree with you. I grew up my knowledge precisely with the start of the fractional and picosecond technology. So I couldn't see all the shift, but I can see the great results, not only in the aesthetic dimension, but also in the medical dimension.
Absolutely.
So do you think this technology should be available in every dermatology clinic, every consultation? Do you think this is something that only trained professionals should be using, or what can you recommend to the future dermatologists?
Well, I mean, obviously there are always going to be limitations in terms of access to some of these energy-based devices. But yes is the answer. I do think, knowing how much I know that these devices can work and make considerable changes to the disease course, improvements in quality of life of patients, I do think that they should be part of what I would call mainstream dermatology treatments. Just like we have the biologics, we have advances in dermatologic surgery, in the way we treat, for example, skin cancers. I do think that these laser technologies should be part of mainstream dermatology. And that includes both the public hospital as well as private clinics and private hospitals. I can give you just one example, scar management. So scarring is something that hugely affects quality of life of patients and the sufferers. And there are, of course, some interventions when it comes to, for example, surgical revision of scars. But there is plenty of evidence and tremendous experience in how much the combination of these laser technologies, the vascular technology, the fractional technologies, be it the ablative or the non-ablative, can considerably improve the scars and change people's lives and improve on the quality of life. So that is just one example. But other examples would be things like birthmarks, port wine stains, severe rosaceas, where there is considerable effects on the quality of life. All these dermatological conditions, pure dermatological conditions, can be considerably improved with the use of laser technology. And it doesn't have to be one or the other. This afternoon I was speaking to a group of Chilean dermatologists on vascular lasers, and I was explaining that you don't need to abandon traditional treatments for rosacea, such as topical antibiotics, topical ivermectin, low-dose oral antibiotics and tetracycline. You can still combine those treatments with laser technology, and what you'll get is faster results, better improvements in the condition, and long-term remission. So I do think that these technologies should be available as much as it's practically possible.
Yes. Okay, also very interesting. I think it's important, and I would like to ask you about this, about the safety, because the safety of the new technology allow us to reach more people. I mean, for example, babies. What can you tell me about that? Do you think, have you felt that or seen a really good improvement in the reach for all ages or all kind of skin, for example?
So safety absolutely is going to be the number one top priority. Safety is going to be a priority because, as you said, if these technologies are going to be more widely available, more patients are going to be treated, that potentially means more compromise if the safety is not optimal. Now, one of the good things about Candela laser companies, one of the main largest laser companies in the world that I collaborate with, one of the good things about the Candela laser company is that they have technology that has been proven to be effective and, most importantly, safe in children. So, as an example, the V-beam, which is the vascular laser from Candela, that specifically has a clinical indication, which is FDA cleared and approved for vascular capillary malformations in children. So we talk about young kids with vascular malformations where absolutely the V-beam perfector is safe, it's been published, it's studied, and it's very effective. And I cannot say the same about some of the other lasers in the market. And then if we look at the adult population, and if we look at the higher skin types, so the higher skin types that you can find here in Latin America, for example, you always have to protect the pigments and the melanin, because otherwise you can get pigmentary challenges and problems as a result of the laser. Again, advances in the picosecond lasers that allow us to use a very short pulse duration with little to no generation of heat means that we can now safely treat many of the pigmentary conditions that we, before picosecond lasers, were somehow struggling because of the existing technology. Now we can safely treat them. Improvements in the cooling method, which again can reduce the complications. And this is what I mean by the advances in the technology. It's not necessarily just new technology and new indication for treatments, but it's existing technology that just got perfected in terms of the cooling, delivery of the energy, safety for the patients.
Excellent. And I cannot let pass this question about if you think that there is a possibility for energy device treatments in the oncology field. Do you think perhaps is going to be developed towards that direction?
Well, I mean, I think when we understand cancer biology well and understand how energy-based devices can influence that, I will not be surprised that perhaps energy-based devices will play a role. I mean, within, for example, prostate pathology, the holmium laser is being used. If we talk about cutaneous oncology, we have many studies and publications on the use of the vascular lasers, including the Candela vascular lasers, on basal cell carcinoma, on the superficial subtype and the low-risk nodular subtype. I mean, it's not perhaps the type of systemic oncology or organ oncology that you may be thinking about, but I think this is a first step, okay, from the cutaneous oncology, the basal cell carcinomas, the non-melanoma skin cancers, actinic keratosis, bone disease. We know that there is a role that lasers can play, or light-based devices, including photodynamic therapy, which is also often referred to as PDT. So I think time will tell. Once we understand better the role of light in cancer biology and how it will modulate it, I do not rule that out.
Excellent. It's a very optimistic view. I hope we get there. And one last question, Doctor. Professor, what advice can you give to young dermatologists? What can you give them through your experience and knowledge? What can you say to them?
I think my best advice to future dermatologists and young dermatologists is dermatology today in 2023 is different from dermatology 20, 30 years ago. Dermatology today is a broad specialty. It has a medical aspect, it has a surgical aspect, and if you look at the energy-based devices and the laser components of dermatology, that is growing massively. So what I would say to the younger dermatologists is have an open mind. In case you were trained or educated in a public hospital with limited access to laser technology, it's never late. You can still have access to training, seminars, attending conferences. Embrace the laser dermatology field, because I can assure the younger dermatologists the future is going to be heavily skewed toward part of the immunodermatology, which is the biological therapy, and the other side is going to be the energy-based devices and the lasers. And we see that, and this is why we see many of the non-dermatologists getting very excited and trying to learn that. Now, we have the advantage of understanding the skin pathology and how that can be optimized, not only with laser treatments, but with medical. So my advice is embrace laser dermatology, try and learn it. There are many opportunities, attending workshops, seminars, conferences. Here in Chile, there's ATM company that's have invited me, and we have a workshop and some lectures tonight. So try and get involved with that, because at the end of the day, you'll be able to offer a better service to your patients.
Professor Firas, thank you very much. You are very kind.
Thank you. Thank you for having me here, and thanks for the interview.
No, my pleasure.
Thank you.